Hello people, welcome to my channel Physio Guide by Divya. Today I am going to teach about important topic Parkinson disease. This is a main topic and I am going to explain briefly. I am going to cover every subject like clinical features, pathophysiology, etiology, complications, treatment, everything I am going to cover. So let's start our video. First of all, what is Parkinson disease? Means it is a chronic progressive, means day by day it increases, the disease increases of the nervous system, means it affects the nervous system, characterized by four cardinal features are seen. What are the mainly four features are seen in these patients are rigidity, tightness, inability and they'll bend, tremor means shakiness is seen, bradykinesia means slowness in movements, they'll walk slowly, postural instability. Okay, these four features are seen in these patients. Onset means this Parkinson disease onset is gradual, means slowly, gradual and slow rate of progression, slowly it develops. As a result, we'll see they can't do daily activities, disturbance in daily activities is seen, and depression also are common in individuals with Parkinson disease. Now epidemiology, how much rate this Parkinson disease is seen in the population means Parkinson occurs in 1% of people in older than 55 years, and it is seen 2.6% of people in 85 years of age. Okay, males are more prominently affected than females. Next, etiology means origin, where this Parkinson disease started, means the term Parkinson's disease is used to refer to a group of disorders that produce abnormalities in the basal ganglion. So this in etiology, how it starts, it is divided into 6 stages. Primary Parkinson's. First one, primary Parkinson. This is most common and it affects 78% of the patients, and this cause is how it occurs means it's unknown. Now secondary Parkinson. In this means post-infection Parkinson. This is in this type Parkinson has been reported means reported in conditions like cryptococcal meningitis, encephalitis, Jacob-Creutzfeldt's disease. So in this it is reported in these patients. Now Parkinson plus syndrome, neurodegenerative disease can affect the substantia nigra and produce this disease. Next one, toxic Parkinson. These symptoms occur in people exposed to industries like which contain industrial poisons and chemicals. Okay, those are mostly affected. And pharmacology means a variety of drugs that produce extrapyramidal dysfunction. Okay, that mimics the sign of the that produce Parkinson disease. Parkinson is rare in causing metabolic cause, but in conditions like there is deficiency in calcium metabolism, the metabolic cause includes hypo and hyperthyroidism and hypoparathyroidism. We'll see the pathophysiology, the disease, how it develops. First of all, we'll see basal ganglion, a collection of the nuclear masses deep into the brain. Okay, this as a result, what these basal ganglions do, it plays a very important role in voluntary and postural adjustment, control of postural adjustment. Information is transferred through multiple circuits. These complex circuits are divided into two pathways, direct pathway, indirect pathway. In this direct pathway, it facilitates the flow of signals to the thalamus. So it activates some movements. This indirect, it inhibits information flow and suppress other movements. Okay, now this is divided into input and output. Okay, so as a result, the damage to this basal ganglion results in the motor disturbances seen. This is divided into hyperkinetic and hypokinetic. Over movements are done by the patients like chorea, dystonia, dyskinesia. These are the hyperkinetic movements example. And hypokinetic means akinesia and bradykinesia means slow. Bradykinesia means slow rate of movements. So then this Parkinson disease generally inhibits and degeneration of the dopaminergic neurons, so that produce dopamine. So degeneration of these dopamine neurons in basal ganglions, as a result there will be no dopamine produced. So the direct and indirect pathway are affected, and reduction in the spontaneous movements are seen, and tremor, rigidity are viewed due to loss of the inhibitory influence. What are the symptoms seen in these patients are, first one, rigidity. Rigidity means the patient complains heaviness and stiffness of their limbs. Okay, this is felt uniformly in muscles and both sides of the joints. Okay, both sides of the joints in both directions. In this rigidity, it is of two types. They are cogwheel and lead pipe like rigidity. It affects proximal muscles firstly, like shoulder and neck muscles. Next, it slowly progresses to muscles of face and extremities. Next, prolonged rigidity means slow increase, means in them there will be decrease of range of movements, ROMs, and as it is, contractures and postural deformity is seen in this rigidity. Next one, echinacea or bradykinesia also we can say. Echinacea refers to difficulty in initiating movements, okay, or freezing may occur, and is characterized by sudden break or block in the movements are seen. Bradykinesia means slowness and difficulty in maintaining movement. Movements are typically reduced, there will be reduced in speed, range, amplitude. So this is termed as hypokinesia. And patients with this Parkinson disease demonstrate micrographia also, abnormal in writing, small handwriting, and difficult to read also we'll see. Next one, tremor. Tremors means shakiness we'll say, no? These tremors are seen in 50% of the Parkinson patients. These are seen more often in resting tremor. Resting tremors are seen mostly, and they disappear while they are doing any voluntary movements. Okay, so some people experience postural tremor also, while standing also they'll feel tremor. Postural instability, in this patient experience increase in the difficult during while doing any activities, okay, like self-initiating. If they want to walk, turn selfly, they feel this difficulty. In this, the patients may fall once in a week. 13% of the patients fall once in a week due to this postural instability. So other complications are seen, other complications other than this, other complications also we can see in this some patients, like poverty of movement, fatigue, masked face, musculoskeletal changes, gait disturbances, swallowing and communication disability, visual and sensory motor dysfunction, autonomic dysfunction, cardiopulmonary dysfunction. Next we'll see diagnosis. How to know whether it is Parkinson or not. Means early diagnosis of Parkinson disease is difficult. Diagnosis is usually made based on the history and clinical examination only. For example, like we can take the handwriting samples and speech analysis examples can be done. Diagnosis of these patients can be taken by at least two. If there is any two cardinal features only are present, we can identify this as a Parkinson disease, and Lewy bodies are identified in this PET scan in the later stage. Okay. Now, pharmacological treatment in this drugs are divided into early protective therapy and next systematic treatment in the middle and last stage. Okay, these are the some drugs are given in this. I'll mention in the notes description below. Once check. Nutritional management also plays a key role in this Parkinson patients. In this, high calorie and low protein diet is advisable. Then surgery management is surgical process. These are the stereotactic surgery. Pallidotomy means where tiny electric probes are inserted on the head. The thalamotomy, deep brain stimulation can be done. Next we'll see the physiotherapy management, relaxation, flexibility exercise, mobility, balance, gait, respiratory, group exercises, motor learning task. These all we need to teach them. First of all, relaxation exercise. What are the relaxation? To decrease the rigidity, stiffness, firstly we need to give relaxation exercise. Gentle rocking and rotational exercise can be produced for relaxation of excessive, means fast moving muscle tension. Okay, now slow rhythm, this rotational exercises should initially should be done in fully supported position, like in positions like supine, supine slow side to side head rotation, and in supine only bilateral PNF pattern should be followed. Upper trunk rotation and hook lying, sit like this, normal hook lying position, knees bend. Lower trunk rotation need to be done, and side lying trunk rotation plus scapular movements are to be done. PNF techniques are to be followed in the relaxation technique exercise. Next, flexibility exercises. Flexibility for flexible movement of the muscles. Both active and passive ROM exercises are to be done to improve flexibility. And PNF technique like hold and relax. Hold and relax technique should be followed, and stretching techniques to elongate muscle. Stretching is combined with joint mobility, so stretching with joint mobility movement, okay, to reduce tightness of the joint capsule and ligaments around the joint. Next one, mobility exercises. Here mat exercises starting. Next, PNF extremities while sitting, means hold relax type. Next, in standing, rotational movements of the trunk can be done. Next, and reciprocal arm swing or reaching movements can be used to promote trunk rotation. Mobilizing facial muscles to massage, stretch, manual contracts, verbal commands can be used to enhance facial movements. The patient is instructed to practice lip pursuing movements of the tongue, swallowing, facial movements like smiling, frowning, etc. Those should be practiced. Next, balance activities, weight shifting from one hand to other in both sitting and standing. For example, weight shifting, how? Like for example, picking up an object from the floor and tying shoes, movement transfer like sit to stand, half kneeling to stand, and stepping are taught. The single limb stance, side walking, all other exercises. Next, gait training. What are the goals to increase the gait? Increase proper gait means to lengthen the stride, broaden base of support, increase stepping, improve heel to gait pattern, increase contralateral trunk movement of the arm swing, marching at place to improve hip flexor, reciprocal arm swing using sticks. Okay, now respiratory exercises, diaphragmatic exercises, air shifting techniques, exercises that recruit neck, shoulder, trunk muscles. Okay. Group exercise which provide motivation to the patient. Motor learning task who need to demonstrate. Next, repetitive of that movement by breaking down the task into simpler forms, okay, so that they can understand. I hope you understood this topic. I'll give the notes also in description. Thank you for watching this video.